Hi guys! So for today's video, we are going to discuss the 12 different cranial nerves, and we are also going to perform different clinical tests for each cranial nerve. But before performing the clinical tests, make sure that you inform your patient.
For our cranial nerve number 1, we have the olfactory nerve. So this nerve is for sensory, and it is for the sense of smell. So basically, the organ involved in this nerve is the nose. So for our clinical test, I will going to test the patient's ability to identify familiar scents. So I will going to let my patient to close his eyes, then he should identify the scent of what I am going to let him smell. So Mr. Alvin, kindly close your eyes. So ready? Can you smell that one? So what is it?
It's Vicks.
So correct. So this is indeed Vicks. This means that Mr. Alvin's olfactory nerves works well.
Cranial nerve number 2, optic nerve. The function is responsible for vision. For the clinical test, we may also assess the visual fields by confrontation and examine the optic nerve. So what you're gonna do is to have the patient one arm length away. After that, first cover your left eye while I cover my right eye. You might want to look at my eyes only and do not look at my fingers. Say the number. Wrong. Let's do the opposite.
Alright guys, for our next cranial nerve number 3 is the oculomotor nerve, which function motors controls most extraocular movements and eyelid elevation and pupil constriction. Now for our clinical test, we check the extraocular movements by asking the patients to follow the H pattern, which also inspect the ptosis and test pupillary light reflex. Now, sir, may you stare at this ball pen and follow it. And now for our next cranial nerve number 4 is the trochlear nerve, which function motors controls the superior oblique muscle responsible for downward and inward gaze and the eye movement. The clinical test we used to do is the patient follows a downward and inward gaze, which difficulty may indicate the superior oblique muscle palsy. Now sir, please stare again for this spoken.
Next, we have the cranial nerve number 5, which is the trigeminal nerve. So this is both motor and for sensory. So this involves the facial nerves and the jaw as well. So for our clinical test, I will be slightly touch some part of Alvin's face, and he must feel that one. And for our second one is that I will let him clench his jaws, and he will open it and I will try to resist it with force. So let's start for our slide touches. Do you feel that one?
Yes.
About this one?
Yes.
Okay, about this one?
Yes.
Okay, so that is good. Next test is, can we clench your jaw and close your lips? Then I will put my fingers here and try to open your mouth. Open. Okay, so that is good. This means that his cranial nerve number 5 is good as well.
And for our next cranial nerve, which is the abducens. This cranial nerve, its function is motors, controls the lateral rectus muscle for lateral eye movement. And for the clinical test we used to do is we ask the patient to look laterally. Inability to abduct the eye suggests abducens nerve palsy. We use flashlight to see the dilation and the constriction of the eye. Now, sir, please stare some far objects outside.
Now we have the cranial nerve number 7, which is the facial nerve. So this is for both sensory and then for sensory and motor, and this involves, of course, also our facial nerves. So for our clinical test, I will let my patient perform some things, and then my patient should do it with ease. So first, kindly close your eyes tightly. Okay, kindly smile with brightness. Okay, then kindly puff out your cheeks. Okay, so our patient did that with ease, so this means that his facial nerves is good.
So for our cranial nerve number 8, which is the vestibulocochlear nerve, the function is for the sensory, hearing, and balance. So for our clinical test, we assess the patient's hearing with a whispered voice test. I will cover the other ear of the patient, and the patient will repeat what I have said. So please repeat what I have said.
What?
So next, we have the cranial nerve number 9, the glossopharyngeal nerve. The function is what sensation to the posterior tongue and pharynx based on posterior 1/3 of the tongue and swallowing. So for our clinical test, we evaluate the gag reflex and observe the patient's ability to swallow. We ask the patient to say and observe the uvula for midline elevation. Voice quality and swallowing are also tested. Open your mouth, sir. Sir, adjust mo a little bit. Okay, sir, that's a good sign of a good gum.
Cranial nerve number 10, the vagus nerve. Both controls the muscle of the pharynx and the larynx, and autonomic control of heart and the digestive tract. As of the clinical test, earlier, we asked the patient to say and observe the uvula for midline elevation. Voice quality and swallowing are also assessed.
We have the cranial nerve number 11 accessory nerve. Cranial nerve number 11 is the accessory nerve, which functions as motor and is responsible for controlling the shoulder shrugging muscles and head turning muscles. To test the cranial nerve number 11 accessory nerve, we have to check the patient's ability to shrug their shoulders against the resistance and turn their head against the gentle pressure. Sir, kindly shrug your shoulder as high as you can as I put pressure. Okay, next. Now the head. Now turn your head to the left against my head. Now to the right. Next, we have the cranial nerve number 12, which is the hypoglossal nerve. Cranial nerve number 12 is the hypoglossal nerve, which functions as motor and is responsible for tongue movement. To test the cranial nerve number 12, we ask the patient to stick out their tongue, check if it's in the midline, and move it left and right. And finally, press it against the cheek for strength. Sir, kindly please stick out your tongue. Okay, now move to the left and to the right. Okay, now press your tongue inside your cheek. And I'm going to press from the outside. Okay? You then conclude that the hypoglossal of the patient is good.
Let's summarize the 12 cranial nerves. Cranial nerve number 1, the olfactory nerve.
Cranial nerve number 2, the optic nerve.
Cranial nerve number 3, the oculomotor nerve.
Cranial nerve number 4, cochlear nerve.
Cranial nerve number 5, trigeminal nerve.
Cranial nerve number 7, facial nerve.
Cranial nerve number 8, the vestibulocochlear nerve.
Cranial nerve number 9, glossopharyngeal nerve.
Cranial nerve number 10,